Next up, from ceremonies and commemorations to barbecues and beaches, many Americans got a first glimpse at post-pandemic life over the past Memorial Day weekend, setting aside masks and social distancing guidelines for the first holiday in more than a year. That's especially true for Massachusetts, which rolled back virtually all remaining COVID restrictions over the weekend after Governor Charlie Baker declared the pandemic, quote, pretty much over in the state as cases and deaths dropped to their lowest levels in nearly a year. Vaccinations soar, with around 65% at least partially vaccinated, but that, of course, still leaves more than 1 million people without a single dose. And as the dean of Brown's School of Public Health, Ashish Jha, pointed out on Twitter, within the state, some communities are getting vaccinated faster than others. He took the city of Newton, which has some of the highest vaccine numbers in the country, including 99% of people over 30, and that's not a typo, 99%, and then compared them with the numbers out of Springfield, which are below the national average, including just 64% of people over 30. He said the differences are driven largely by education, income, and race, and warned Massachusetts and other high vaccination states, quote, your job is not done. So is COVID really pretty much over here in Massachusetts? I'm joined by Dr. Cassandra Pierre, acting hospital epidemiologist and medical director of public health programs at Boston Medical Center, and Dr. Jeremy Faust, an emergency physician at Brigham and Women's Hospital and instructor at Harvard Medical School. Doctor, it's good to see you both. Thanks for being here.
Great to be here.
Dr. Pierre, starting with you, assume you agree with Dr. Jha. What is still atop your to-do list?
Well, this is certainly not over. There's, even though we know we've seen declines in infections, hospitalizations, and severe disease and death, we know that there are a significant number of unvaccinated people in undervaccinated communities in which we could see small spikes and maybe even larger spikes when the weather changes. We also have not yet vaccinated children. People under the age of 12 are not yet authorized to be vaccinated, and older adolescents and teens are still under-vaccinated. So we still have quite a bit to do, especially in those communities that Dr. Jha mentioned.
Dr. Faust, what would be on your list?
Yeah, vaccination is the only way out of this. When I saw that tweet from Dr. Jha, it inspired me to go dig into those data. And it's even worse than it sounds, because when you look at the areas where there still is a problem, it is precisely the areas with the least amount of vaccination. Yeah. So places with the most cases, we're looking at places like Hamden and places like Bristol. That's where the less than half of the eligible population has been vaccinated. So the work ahead of us is really mainly about getting shots into arms.
Well, you both seem to agree, but Dr. Faust, staying with you for a second, it seems to me without many vaccination mandates, there are virtually none, and with very few requirements that people show proof of vaccination to get in anything, it seems to me we've created a disincentive for the unvaccinated to still get vaccinated. Am I wrong?
Well, to some extent, when you reach a point where enough of the population is truly immune, then the other people could benefit from that. That's not the way you want this to go. You want this to be, we're all in it together. And I think that there has been an incredibly good trend overall from earlier in this year, where we heard that fewer than half of Americans at one point would get the vaccination, but the numbers kept rising. And we've seen a lot of things change, and we've seen some surprises. Look, one of the hardest groups to reach has been white Republican voters in the rural districts. So we're learning about this, and what works in one area doesn't work in another. So reaching those kinds of voters takes different messaging than other groups with vaccine hesitancy or deliberation.
Dr. Pierre, I want to get back to the other thing you said, that we hadn't vaccinated, obviously, kids under 12 because there hasn't been any authorization yet. I'm sure you've read some leaders in your field suggesting that we should actually put that on hold, that the risk to those young kids is so minor compared to the risk to the individuals in countries, India being at the top of the list, which are grossly under-vaccinated, and their risk to us as a result, variants, those sort of things. Do you subscribe to that notion that we should put these younger kids on hold to help take care of the rest of the world first, or no, Dr. Pierre?
I'm always a maximalist. I want everything at once. And in this case, I want both. And I know that for some, that's not realistic. The truth is that we seem to have these separate realities where, on one side, the governor of our state has said that COVID is almost over. And on the other side, obviously, we have pandemics raging in India, Nepal, South Africa. It is terrible and heartrending to watch. I think that several months ago, even a year ago, this was probably this is something that you could see happening down the way. And so people have tried to think about, how do we get the production of vaccines up in different countries? How do we do more effective shares? The United States is committed to donating a sizable amount of vaccines to other countries. And I think we need to hold our country accountable for that. At the same time, even though the risk to children is lower, it is not zero. And we have had deaths in children. We have long-term complications of COVID-19 in children and severe disease in children. So as a mother of young children myself, I think that it would be wonderful to get this. Obviously, the priority is global vaccination, because until we have really good coverage around the world, this really won't be over. My hope is that we can prioritize global vaccination, but hopefully also get enough vaccines to get to our children as well.
Dr. Faust, can I return to the United States with you for a minute in the topic of mandatory vaccination, which is virtually non-existent? A lot of legal experts think as long as it's an emergency use authorization phase as opposed to full licensure, you can't mandate it. But when I read the story this weekend about the 117 staff people at Houston Medical Center, Methodist Hospital, suing because there was a mandate there, I almost had a stroke. Is there any reason why a healthcare worker should be allowed to work with patients if they aren't vaccinated, Dr. Faust?
My personal belief is that would be a pretty high bar to clear. The way they framed it was they don't want to be guinea pigs, but the way I frame it is, well, now they're going to make their patients guinea pigs.
Exactly.
See how it goes with incomplete vaccination in a major medical center. So I imagine that the hospitals are going to line up behind vaccination to the extent that they can, given their workforce priorities. Of course, they have to worry about workforce priorities, and so they have enough people willing to do it. And I think that's really where the rubber meets the road. The thing that I think bothers me as a public health professional, as a physician, is the failure to have done a risk assessment. We don't know the long-term risks of any of these vaccines because they haven't been around very long. Mm-hmm. But we know is the short-term risks are astronomical with COVID-19, and the vaccine just pretty much negates that, just eliminates it. So in my mind, any long-term effect from the COVID vaccinations is probably going to be negligible and certainly not as bad as long-term COVID. We know that people are suffering long-term from COVID. So to me, the part that's just so troubling is the failure to have engaged with the data when they make those kinds of decisions, and to the extent to which that puts patients at risk.
We only have a minute left, doctors. I'd like to start with you, Dr. Pierre. Is there anything you won't do personally that is permissible under new CDC and Massachusetts guidelines?
I probably won't go to a concert right now. I feel like an old lady now anyway. But I probably won't go to a concert aged mentally in this year. But, I think, based on the science that we have, certainly it is allowable to go indoors. We have good evidence to show that fully vaccinated individuals are safe in this context. But I think that I really get itchy and uncomfortable in large crowds. And part of that is also just trying to adapt. But part of that is just wanting to make sure that we're all doing our part to get vaccinated and stay safe.
Dr. Faust, you have 30 seconds. Anything on your list?
To me, what I'm looking for is what we're going to do with masks in the fall. I don't know what's going to be there, but in terms of my child, it really has to do with how crowded spaces are with the unvaccinated. So in a town with one case out of 100,000 and 5 kids in a room with the open air, sure, I would send her in without a mask. But if someone's going to tell me that it's okay for her to go into my 3-year-old, to go into a room of 50 unvaccinated kids in a high-risk area, I'm going to say, no, thanks. I'm putting the mask back on her. And she's been fine with it. She's adapted well to both situations. So I think that really, again, the way to make it all work is to decrease cases, and the way to do that is to maximize vaccinations.
I'm with both of you on those final thoughts. Dr. Faust, Dr. Pierre, thank you so much for your time. I appreciate it.
Thank you.
Great to be here. Thank you.